the pastors have asked me just to spend a couple more minutes going through what we're doing today. And the reason for that is that we need to work through, there's a few mixed messages coming out and there's a bit of confusion about what we should be doing and why we should be doing it. So we're just going to spend a little bit of time today just to make sure that we all know what the plan is and why that is the plan. So I guess developments over the last week. Well, there was a big one, unfortunately, on Thursday, that across the world, we got to 1 million confirmed cases. And I guess the issue there is that the actual number of cases is vastly higher than that, because to confirm it, we have to be able to test for it. In Australia, if you look at the numbers below there, over the last 3 weeks, we've gone from 1,000 to a bit over 3,500 to 5,500. And wherever it is down below me here, you can see that that curve is just turning a little bit flatter. Is that curve flattening enough? Well, I guess there's two questions there. Are we doing enough individually? Are we doing enough as a society to change this? And the slide here I put up last week, which goes through how much do we have to change what we're doing to actually change this. And we actually need to be dropping the amount of contact we have with each other to 90% less than what it was. And the issue we've got at the moment is that a lot of the current flattening that's going on that curve, and it's not actually all that flat yet, has actually happened because we've shut the borders. So a lot of that is something that we can't repeat a second time. The borders are now shut. So what more do we know than we did last week? Well, we're actually getting more idea about how many people have this illness and don't know it. And out of the US, we're seeing some data that suggests that it could be up to 80% of people who get sick with coronavirus actually don't know they're sick. And so that really raises a bit of a question for you. The picture I've got there of somebody sneezing and coughing, well, I think we're all going to run away from that person. If they come down the supermarket aisle doing that aisle's going to be pretty empty. They can have all the toilet paper in that aisle. But if we don't know if we're sick or not, then we've got a bit more of a problem. So the issue really for you and for me, and it's actually especially an issue for me working in medicine where I see patients, and actually this week I saw far less people face to face for precisely this reason. It's a little bit to protect me, but it's more to protect them. If I can avoid seeing that person, then I can't give it to them. So really what we're looking at there is we need, and this is one of the big misconceptions out there, that you actually don't need to look sick to be sick. And we really want to make sure that people are aware that you could have this virus without knowing and give it to somebody who will look sick, and they'll look a little bit more than sick quite often. So what must we do? Well, I guess if you're a member of the Rubber Fellowship, then you're used to hearing this question, what must we do? We read it in Acts chapter 2. And in Acts chapter 2, we're talking about what must we do to be saved. And in this situation, it's actually not that differently. In Acts chapter 2, we want to take it seriously. And this issue here, we actually need to take quite seriously. If you have a look at the picture on the side here, unfortunately, that was taken yesterday. That was in one of the Brisbane markets. And you can see an awful lot of people, and apparently most of the day that market was that full. And there's certainly not 1.5 metres between all those people. I'm not sure in Adelaide whether there are any markets like that, but I've heard bits and pieces from other countries and other states around that there were plenty of places where more people were together and were a lot closer together than we can actually get away with. We do have to keep to this physical distancing of 1.5 metres. We have to be careful when we cough, we have to be careful with our hands, with our face. But the last bit's the really important bit. Stay home. If you actually don't need to be out anywhere, if you don't need to be doing something, then these days with the internet, I think all of us have got a mobile phone, or the vast majority have got a mobile phone. There are plenty of ways for us to stay connected that don't require us to go out. And every time you think about going out, you have to keep your distance. But the reason you're keeping your distance is not to keep you safe. It's worrying about, are you sick? Are you the person who's going to spread this? What about masks? For those here, there's a few people here who aren't laughing because they can't see me in my high-vis vest, which I have to wear when I go out to the car park. and my mask and my sunglasses. But for those who can see it, thank you for laughing at me. And in some countries, everyone wears a mask. And the World Health Organization was until a couple of days ago saying that that was not needed. And now they're sitting on the fence and saying that some countries may, some countries may not. So we really need to talk about masks. And when I'm wearing a mask at work, it's probably 80% protecting the person who I'm seeing and 20% protecting me. But people who don't know what they're doing with a mask are not going to be protecting themselves very much. Because if I touch that mask, if I touch the front of it and then scrub my eyes, then I've transferred anything off the front of that mask into my eyes. Or if I scratch my ears, the same sort of thing. When I take that mask off, I need to alcohol my hands first, then take the mask off and dispose of it, then alcohol my hands again. And if you're wearing a mask all day to go out to the shops because you think that makes you safe, how often are you going to touch that mask? So the populations where people do wear a mask, it's everyone wearing a mask so that I'm wearing a mask to protect you. This is the way it's working. So we need to be a bit careful of random people wearing masks. Are they actually safer or do they think they're safer? And so we're just got to be aware of that. And the other misconception out there, I've heard people saying 6 weeks, I've heard people saying 3 months. How long will this go on for? And I guess that's a very open-ended question because we really don't know. If we individually, so that's if you and if I do the right thing, and we do it at least 90% of the time, then we might get out of this in 6 months. And over that 6 months, we may be able to continue to go to Bunnings, and I'm not sure if anyone actually is still getting their hair cut, but you may be able to still go get your hair cut, and the other things that we want to be able to do to move around. But if things get worse, this concept I've got there, what about community spread? Well, if we get more community spread, which is now what we're left with because we've shut all the borders, there's nobody else bringing it in, it's us spreading it if it still spreads, well, what does the government do? People are upset that they've done what they've done, but if we want to be in control of our own destiny, then to be in control of our own destiny, then we actually need to be part of the solution, and we need to make sure that we're not going close enough to people that we can spread it, because then we can't catch it from them either. So it does both things. And so as individuals, you and I are now responsible and are in control of how long this goes on for and how bad it gets. And Darrin's tip, which everyone loves, apparently. Thank you for Pastor Chris. Yeah, he's laughing in the corner there. So Darrin's tip for today is be kind to each other and support each other. And for those who are reading their Bibles, if you're reading some of the book of Hebrews, I've read through Hebrews chapter 12 quite often in the last week or so, and really looking at the ways that we can get through things. And straight on from Hebrews 12, we get to Hebrews 13, verse 1, let brotherly love continue. And I guess brotherly love in this situation is us looking out for each other. So if you're at home, and I don't know about some husbands and wives, but certainly we're more at home than we were because we can't go out, and stress levels are a bit higher, having 2 kids at home who are meant to be doing homework and schoolwork, and it can get a bit interesting at times. Make sure you're being kind to each other, and make sure you're giving each other a little bit of slack, and make sure you're working out how you can support each other, because through this time, that's what we're going to need to do. And as a church, as a fellowship, we want to make sure we're supporting each other by ringing each other up. And if we jump to the next slide, the different ways for us to support each other. This is the very last slide. We can pray for each other. We can make sure that we're swapping some encouraging scriptures and some ideas and thoughts on how things can move forward. We can swap testimonies to do the same. I'm sure that a lot of you today have enjoyed this live stream, and encouraging people who have missed today to join into the live stream. And over the coming weeks, we're going to have more Zoom meetings, other platforms, all sorts of ways of us getting together in spirit, if not in person. And there's still good old email and phone. So I just want to encourage everyone that this is going to be something that's going to go on, and we're all going to get a bit sick of it at times. But if we can support each other through this, and we can be kind to each other through this, then we'll actually come out the other end of this, and we'll be able to keep those things we've learned about being more kind and more supportive as we move forward. Thank you very much.